reduction in costs for basic benefits and care, as well as just some of the basic proposals we have right now. With there's a with some of the tax cuts we've already had, we've got the issues that we want to be able to help to fund this. Just the, for example, the Bush tax cuts of the previous few years can pay for almost, I believe, twice what pay for our plans cost twice if we can simply let these lapse to the same rates that we had during the Clinton era. Which I'm sure most of you know was a record level of prosperity for America at the time.
We are absolutely on the road to overall bankruptcy for this country if we continue with the method of entitlement program creation that we've been on as a country since FDR's policies. I mean, some issues in funding for Medicare and Medicaid, let's get serious, 60% of government spending goes to entitlement, 60%, okay? And the plan for the Democrats to actually pay for this is through raising taxes on businesses, eliminating tax breaks for businesses that provide health care for their employees now, eliminating existing tax breaks for medical savings accounts, and creating new taxes on alcohol, soda, sports drinks, energy drinks, and iced tea. I mean, did you enjoy the soda they provided in the back of the room? Because I'm sure it's going to be more expensive next time we do this. If the Democrats have their way, we have to start funding these entitlement programs with just absolutely absurd increases in taxes and eliminating tax breaks. The Democrats' health care plan will cost over $1 trillion in additional federal spending, and that's about $8,000 for every taxpayer in benefit today. So, did you want to?
Yeah, I just wanted to point out.
If the Republicans want to link their new proposal for health care to basically assaults on the Great Society programs and say that, you know, we need to change the fabric of Social Security and Medicare, you know, I would say that that's not a very serious policy at all. You know, scare tactics about the financial health of Social Security and Medicare are equally scare tactics when you make an analogy to healthcare. You know, in 2005, in the State of the Union, President Bush, you know, said we must privatize Social Security or it's going to go bankrupt, which is not true. You know, obviously policies will need to change over the next 20 years, but this scare tactics about, you know, we must privatize or it's all going to, you know, go down the drain. You know, I mean, we've seen, you know, the failure of policies in this area. You know, imagine if we had privatized Social Security along the lines as what the last administration wanted. You know, that wouldn't have worked really well when Lehman Brothers came around. You know, I would say that the Republicans have no policy right now to avert a healthcare Lehman Brothers, and in fact, the policy they're proposing would do just that.
Thank you, Ben, for attacking Social Security and this healthcare debate. In terms of the tax levels that you'll be paying for this new plan, in some states, once the Bush tax cuts expire and if the tax increases proposed in the House bill, individuals may be paying as high as 54% of their additional dollars earned to the federal government. 54%. Once you reach that high level of spending, that's higher than the highest tax rates in Britain, in Germany, in Japan, and all these fully socialist countries. What's the point in working? And in terms of will the healthcare reform be structured like the other entitlement programs? Yes, absolutely. The government has never managed to create an entitlement program that wasn't a money drain, that didn't create huge problems for everyone down the road. There's no reason to think that they'll be able to do it now.
Exactly.
Thank you. And now to the fellow Republicans. Why should members of Congress like Max Bucket be able to get into a public health care option if such a program isn't good enough for average Americans?
Will you please explain the question? Yeah, will you explain the question, Ariane?
Why is a public option good enough for public employees but not for everybody else? Why shouldn't they have that option?
I mean, I'm sure the public option would be mandated by law, obviously, to provide fine quality health insurance, at least in the short run. The problem is that it would be subsidized by the federal government. It would inherently be subsidized because it is in law. It cannot go away. It cannot fold into bankruptcy the way the private insurance companies can. When you do this, it's backed by literally unlimited resources of the federal government, and it can set its price however low it wants, however low the people who want to be elected decide to set it so that people will vote for them. Private insurance doesn't have this luxury at all. They will have to fold and we will devolve into a single payer system where the government is the only provider of insurance and you have no recourse against what you're doing besides the ballot box, which isn't nearly as effective as changing your business and taking your money elsewhere.
So what I'm hearing is that the Republicans object to the public option because they think it would be too effective at controlling costs. I mean, I think that's kind of an astonishing admission, actually.
I don't quite understand why, so far from what I've understood, is that the Republican plan was to help subsidize payments by private insurance, or subsidize private insurance to be able to pay for health care. But the same thing they're promoting at the moment is it's simply being, the insurance program is being subsidized by the federal government, the public option being subsidized by the federal government. I don't understand when a subsidy is a problem, except only when it's actually funding private insurance instead of a public option.
I'm not sure what you mean by I'm saying that it's too effective. I'm saying that it will be eminently less effective than private insurance. It will reduce direct cost to the consumer and be made up for in tax subsidies by the federal government. And if it's anything like Medicare, it will have higher overhead payment per patient and cost more to run and be wrought by fraud if it's anything like every other government program that exists. So to say that it's too effective would just be a blatant distortion of my words. It's much less effective than the private option, and I think it would be an unsustainable thing in the long run that would simply lead to a government bureaucrat dictating your health insurance.
I just think that when you say things like this will become wrought by fraud and just a terrible failure like every other government program, you're really betraying like an ideological stance that everything government does is bad and nothing government does is good for the American people. That I just think is not in the mainstream of American tradition or what most people think of today. Obviously, we see similar things in every other aspect of life. That if you want to mail a package, you can mail it through the U.S. Postal Service, the post office, or you can mail it through UPS or FedEx. And all three of those services are good. You can choose which one you want. What I'm hearing from the Republican side is they want to deny you the option of a public option. They want to shoehorn you into a private insurance sector that in a lot of cases, in most cases, is not looking out for their policyholders. If you go to Alabama, 90% of the market is controlled by a single insurance company. If you go to 34 states, less than 5 companies control a huge percentage of the market. I don't know why there's this ideological objection to the same kind of health care that members of Congress and other federal employees get.
Thank you. And for the College Democrat, what solutions do Democrats offer to combat the unnecessary expenses, excessive malpractice settlements, and frivolous lawsuits?
I mean, this is a Republican talking point, for ages that, 15 minutes ago, they said that, well, all we're